I'm going to talk a little bit about Tijuana's HIV epidemic. And Tijuana is a large city. And what I'm talking about now is not so much the epidemic of the entire city, but really what's the sort of regional epidemic that's focused more along the border. And I like to think of it as a melting pot. I don't really know if anyone would put pizza and sushi in the same melting pot, but this is the best picture I could find. So along the border, as Dr. Borges mentioned, there's a huge drug-using population. There's an estimated 10,000 individuals in Tijuana that use drugs, injection drugs. Not sure, we don't know exactly how many of those are located in the border region. There's a large MSM population that uses injection drugs as well. So there's this combination of dual risk factor population, some of which that live along the border region or stay along the border region. Also along the border region is a area, kind of a red light district of legalized prostitution, and there's an estimated 9,000 prostitutes in that vicinity. So then you add to that migrants coming from Central America, kind of on their way to the U.S. or looking for economic opportunity, and now in recent days, a number of migrants from Haiti and the Caribbean are coming to Tijuana as well. And then our deportees from the U.S., as Dr. Borges mentioned, there are a number of deportees from the U.S. that are sort of dropped across the border, some of which don't even speak Spanish. They haven't they've grown up in the U.S. They have no social support network in Mexico, and so they're kind of isolated. And people in isolation tend to take more risks as well. And kind of put all that together with an international border, which sort of blocks movement, migration one way, and also draws people because of proximity to the U.S., and you get Tijuana's sort of regional HIV epidemic. So this is not really a plug, but if anyone has more interest in this idea, John Cohen and Malcolm Linton wrote a book about the epidemic in Tijuana, and there's also a set of videos that UCSD TV promoted, and they kind of give a more graphical representation of what's kind of going on there. So this project is a molecular epidemiology study of Tijuana's HIV epidemic, and it's really based on a passive collection of data from 9 research collaborations and cohorts in Tijuana. A number of different PIs involved, including Dr. Stratti, Dr. Tom Patterson, Kimberly Brower, Carla Wagner, Alicia Vera. And the data was sort of collected from these cohorts sort of passively, and we collected HIV sequence data, demographic data, risk factor data, some related geographic information, and also the residence of these individuals. And 4 of those studies had available longitudinal data. So 2 of the studies were participants were followed for about a year with quarterly screening. In 1 study, they were followed for 2 years with every 6-month screening. And in the last study, which is El Cohete 4, which is the study that Dr. Borges was mainly speaking about, individuals are screened biannually for up to 5.5 years. So I don't need you to kind of go through this slide. It's kind of a big table, but I'll just kind of quickly highlight what's going on in these different studies. So there are 2 studies, Amigos and Hombre Seguro, which are focused on the male clients of female sex workers. El Cohete was the study of injection drug users. And all of these use slightly different sampling techniques, but a lot of them were sort of convenient sampling. The Mujer Segura and Mujer Más Segura were studies that studied female sex workers, some of whom use injection drugs in Tijuana. Proyecto Parejas was a research project that studied sex workers and their non-commercial sex partners. There's another study called a cross-sectional study of drug resistance across Tijuana. This was mainly in chronically HIV-infected individuals residing at sort of long-term institutions. And LACES is a project that looked at MSM in Tijuana, and Alicia's, Dr. Vera has a study looking at prisoners in Tijuana. So we took data from all these studies. We ended up with around 288 HIV sequences from unique individuals. 46% or so were men who had sex with men, 30% were women, 42% were those who had reported transactional sex. Again, we are focused a lot on female sex workers, so that's part of the reason, but we did see some transactional sex in some of the other cohorts as well. And then 27.8% reported injection drug use. When we did our analysis of sort of looking at evolutionary or viral relationships between all these HIV sequences, we found that 42% of them were linked with at least one other sequence, and they formed 37 transmission clusters. So this is roughly what we see in San Diego as well, and some of the work that Dr. Little's been doing in San Diego proper, similar sorts of numbers. So we're getting a reasonable sampling in this area is really what this points out. Then I mentioned we had 4 studies that had longitudinal sampling. And again, don't look at this chart, it's just to point out the fact. So over the course of the observation period, there were 32 individuals that seroconverted in those 4 studies. This started in 2006 and went all the way up till, this table contains data up till July of 2016. Actually, there was 2 individuals that were prior to 2011, and after that, so 30 individuals were seroconverted after 2011. But what I want to highlight here is this. So from April to July of 2016, we had 8 seroconverters. So these are sort of a rapid number of individuals that were coming in that were newly HIV positive. So they had a negative HIV test prior and an HIV test afterwards. All 8 of these were in the El Cuete cohort, were being followed at 6-month intervals. They were all injection drug users. Unfortunately, we only had HIV sequences for 4 of these individuals. A couple more are sort of in process. But of those 4, 3 of them, this is a network map. This is similar to what Dr. Chayon showed you with the whole Mesoamerican cohort. But this is our Tijuana cohort. But 3 of the 4 sequences we had from this April to July time period clustered together, and they actually clustered with 2 individuals that were seroconverters from back in 2012. So again, now we have all 3 were injection drug users, all 3 clustered together, and they all were linked with other individuals, with a pair from 2012. So really, our question was, all right, so now we have this sort of rapidly emerging cluster with 8 new seroconversions in a very short period of time. Again, this is what we've sampled. There's probably more. So what changed? Did something change to drive this dramatic uptick in HIV incidence? Again, we can't really call it incidence because our sampling is not uniform. It's more of a convenience sample, but it did appear that we had a kind of a clustered group of new infections. So a little bit more background. Again, Dr. Borges also already alluded to this a little bit. So along the border with Tijuana in the U.S. is the Tijuana Canal Basin, and the area is colloquially termed El Bordo. And it used to house up to 4,000 homeless individuals and deportees. So people that were deported, that had nowhere to go, they would often end up here. There's a lot of other migrants that would end up here. And a lot of these individuals, I should say a lot, a number of these individuals were injection drug users. And they lived in the canal basin. They were sort of left alone in this area because it was sort of off the beaten path a little bit, I guess. But then there was a sort of public policy shift in 2015, and the government decided that they wanted to clean out the canal and send these individuals to drug treatment rehab. Unfortunately, not everyone agreed to go to rehab. As Dr. Borges mentioned, a lot of these rehab facilities were sort of far away from the center of the city, far away from this, the area they know. So a number of them didn't go, but the police kept up patrols and sort of cleaned out this region and forced everyone to move, whether they went to a facility or not. So we talked about migration and its relationship to increasing HIV risk. So we know that migrants typically take more risk, particularly when they're away from their family. They're more willing to take risks, both sexually, maybe even with drug use. And so the HIV risks in migrants is higher, particularly when they're away from their families. But what about forced migration? Is that sort of a similar sort of situation? So in effect, these individuals living here were in the El Bordo region were forced to migrate. Granted, it's migration is kind of a term that may not fit this perfectly, because migration typically means large geographic distances. This is more of a shift or a local migration. So we kind of went back and I don't know if Dr. Gonzalez is here, but in a number of these individuals, she interviewed them and was asking them, what's different, what's going on, and she found out that a number of these individuals that had been living in El Bordo that decided not to go to drug treatment facilities had sort of shifted their place of residence, obviously, because they couldn't stay in the canal, and also shifted to new shooting galleries to avoid police interactions. And this included the 3 individuals that had clustered in our study. So because in this cohort, Dr. Stratti had designed this survey to sort of collect information on police interactions, we were able to kind of extract that information and kind of look at how these individuals, or if these individuals have been interacting with police. And when we went back and looked through that data, we found, as expected, the individuals living in this, I think this will work, right? Yeah, in this El Bordo region where there was a high incidence of police interactions. And this is kind of what was going on, right? The police were going into the canal region to kind of maintain or keep it clean. They didn't want people moving back in. So there's a high degree of police interactions, and thus, from our understanding of these interviews, is people avoiding these interactions had left and moved to different places, both to reside and to inject drugs. Unfortunately, during this shift, they ended up in places which were, while they were safe from police, they were also away from a lot of the support services that had sort of grown up around El Bordo, the NGOs that would provide some services, needle exchange, and other options, and wound care and things like that. And so they sort of shifted to areas that were further away. Again, whether this forced migration led to also a shift in risk behavior as well, it's unclear. But our hypothesis is this forced migration led to individuals kind of going underground and sort of shifting their risk behaviors a little bit and maybe taking additional risks and leading to potentially this new transmission cluster. So I think that's what I have here. So again, this is a large study with a number of different collaborators, and a lot of this work was done through the primary research studies, and really most of this is just the analysis of the data. But I'd be happy to answer any questions. Thanks.
Great. Thank you, Sanjay. Are there any questions? Yep.
To educate them on what your findings and if they would be open to rerouting where they are so that the injection drug users could be closer to the NGOs?
Not that I'm aware of. I don't know if Dr. Stratti is here. She might be able to address that question. Did everyone hear that question? So the question was, is there any sort of education program directed towards the police in Tijuana so that they would reroute themselves so they wouldn't be shifting individuals from areas that were close to NGOs? And I don't believe so, but I'm not sure.
So, Anik knows more than I do. I mean, I think one thing I would say is that both of the presenters mentioned that actually one of the things they're trying to do, or that they're supposed to do, is actually divert injecting drug users to drug treatment. And some of these individuals are being diverted to this drug treatment. Now, unfortunately, one of the research findings that Claudia Raful is actually examining is that actually the facilities that they're being diverted to aren't really evidence-based opiate substitution therapy centers, which do exist in Tijuana. However, the government has been funding these, effectively, they're sort of drug detention centers that these people who inject drugs are being diverted to. And she's finding qualitatively, through qualitative interviews as well as research surveys, that there may be an increased risk associated with these drug detention centers because they're not really evidence-based, and they're often run by people who are still injecting drugs, and they're getting drugs in these centers. And again, they're involved in this displacement effect, regardless if they go there or they move somewhere else. So unfortunately, whether they're displaced or they're diverted, what ideally would be a good diversion to drug treatment, it doesn't seem like that's an effective process right now.
I think the other, and some of the interviews that Dr. Gonzalez did, you know, the treatment centers that are there, they're outside the city. They're far away from where these people, what they know, and so some of them are not going just because it's away.
There's an additional barrier that often the methadone clinics in Tijuana you have to pay for. So that cost is totally prohibitive for most people who inject drugs. So there are many, many barriers, I think, to that. Anik, did you want to say anything? Okay. Yeah, Miley?
More a question along those lines than anything else. So we are actually hearing about these drug detention centers in Tijuana from our patients. And what we're hearing, and again, we're hearing from people who are using drugs, so, is that it's serving more as like a money generator, so you have to pay to get out.
Right.
And there's a lot of, so people are saying it's more like blackmailing the community than anything else. I don't know if that's also what you're hearing, or?
That's very interesting. Any other questions?
I guess that's me. I just wanted to speak to the police training that Dr. Strathy's group is doing. Jaime Arredondo is a doctoral student who's overseeing this intervention, and it's a police sensitivity training towards injection drug users particularly, and the spirit is to reduce harm and potential for self-needle or needle stick injuries among police officers, as well as reduce the stigma and bias towards injection drug users generally. And this is a very large-scale, ambitious project to train as many of the police officers in Tijuana as possible. So I'm hoping that we'll see the results of that in our collective research a few years down the road.
Thank you for mentioning that. I think one of the real strengths of that study is the evaluation component, because Proyecto Escudo, which is this Project SHIELD, it's this police education program, will have outcomes from among the police, so self-reported interactions with drug users, arrests, needle stick injuries, syringe confiscation. But because in parallel, Dr. Strathy is running this cohort, El Cuete, among people who inject drugs, as this intervention was scaled up across the police force, we can see how that intervention may have affected both police attitudes and behaviors from the police, but we will hopefully also be able to see shifts in exposures among people who inject drugs at the same time. So I think it will be really exciting to see the evidence as it comes forward in the next year or a few months. I think there was another question in the back.
Hi, my name is Patty Gonzalez Zuniga, and thank you, Sanjay, for doing this. I think at this time is very important also to hear that the majority of the seroconverters are not in treatment. I mean, I'm seeing people who were diagnosed, and because of the barriers to access care, they're still on the streets with no treatment. And I think that's an urgent need for an intervention study to provide treatment for these people, because they're not reaching out. And I'm pretty sure that eventually we will have more, more infections, and we're not going to get to the zero that our globally are seeking for. So thank you.